Health Canada is going after your vitamins. I know that sounds ridiculous, isn't it? Eventually, your favorite vitamin brands might just pack it in and leave Canada altogether. The cost to do business is starting to add up with new regulations from Health Canada that they have introduced. I have had the honor to have a special guest on my show today. His name's Shawn Buckley. He's a lawyer and he's taking on Health Canada, and we need him to win. This is a very informative conversation for the people out there that believe healthy foods, vitamins, and nutrition should be used first before you switch over to traditional medicine. Shawn right now is at an Airbnb in Ottawa, and in this interview, he's going to explain to us why he's there. But at this Airbnb, the internet is terrible. His voice is perfect, but there's a lag, so his mouth is not moving with the sound. It's still a valuable piece of information, and it will be worth your time. When he is back at his home and has better internet, I'm going to have him back on the show. Let's go.
Yeah, so Mark, I'm a constitutional lawyer that has spent the last 31 years basically fighting Health Canada. So Health Canada keeps trying to get rid of natural health products. They keep trying to force us into a complete chemical drug model. And I've defended more companies charged by Health Canada than all other Canadian lawyers combined. So I've got a unique kind of insight into the beast, so to speak.
That's great. Well, I look forward to having you because there's a lot going on in Canada that Canadians need to know about, specifically when it comes to health products. Right now, our doctors only prescribe us medicine. And on the vitamin side, there's quite a few things that are going on. Can you talk to us about what's happening in Canada when it comes to vitamins?
So sure. So and I should have in the introduction also indicated that I'm with the Natural Health Product Protection Association, so nhppa.org, and we're a nonprofit that is there to protect our health rights and our access to natural health products. So the biggest thing, Mark, is most Canadians are locked into this model and suffering. So we've got the federal government has made everything a drug. So even vital nutrients, your vitamin C, your vitamin D, if you're eating healthy food to prevent illness, it's a drug. So they make everything a drug, and then they make it so that all drugs are illegal. You have to get Health Canada permission to sell or access a drug, which is absolutely crazy, because in the natural health field, when we're talking about natural health products, we're really talking about nutrients that we can no longer get from our food. I mean, most of the supplement industry is just vitamins and minerals, because the government that has control of our food has basically managed a decline. So we've got, our food is as toxic as it could possibly be without the population rebelling, and is stripped of nutrients. And then the government makes it illegal for supplement manufacturers to sell you amounts that are actually meaningful. So it's almost like we've created this perfect situation for most of Canadians to eventually become chronically sick. And it's actually even an expectation. We all expect to get heart disease or cancer. Well, you know, the third leading cause of death in Canada are chemical drugs taken as directed, which is absolutely insane. But what we're doing is Mark, there's absolute censorship of truthful health information. So let's say a company, a chemical drug company, wants to get an antidepressant approved. Well, I was involved in a federal court case where, you know, one of Health Canada's experts was a psychiatrist who runs a company to get psychiatric drugs approved by Health Canada. And he was sharing under oath, well, you know, to get a new antidepressant approved, I have to give Health Canada 2 double-blind clinical trials showing the drug works, meaning there's this statistical separation on reporting of symptoms with the sugar pill. So he says, right out of the gate, I run 8 clinical trials. So I run 8. He's just learned he has to run 8 to get the 2 that Health Canada needs to approve the drug. Well, did you know it's illegal? If they get the approval as an antidepressant, it's illegal for the chemical drug company to share with you the failed clinical research. That's interesting, isn't it? If people are reporting suicides to the chemical drug company, if they're reporting side effects, it's illegal for the chemical drug company to share that with you, because All they're allowed to say is that they're an antidepressant, that they're approved as an antidepressant. So we've got this censorship, and it's to protect our confidence in universal health care. Because what we've done with universal health care is we've got the federal government saying, well, let's structure our drug laws so that for all but the most minor of conditions, so for all serious conditions and moderate conditions, we will only approve chemical synthetic drugs that have a patent. So it's like we passed a law in Canada saying it's only legal to treat serious health conditions with chemicals and surgery. But we all know this intuitively. If you have to go to the hospital or engage the medical system for anything serious, you know that the only options are going to be surgery or chemicals. And Mark, what's breaking my heart is we've been doing this online health show. We're almost 3 weeks in, and we culminate this Saturday, October 25th, in Ottawa, presenting the third largest petition in Canadian history on the Hill. But we're doing something that's never been done before. We're broadcasting, both at our live events and then for the health show online. And all of it, every day is going to be posted at nhppa.org. So if anyone's missed it, they can watch it. But we have ordinary Canadians telling their stories, and I want to share one with you. So we had Karen Peters speak in Grand Prairie, and she was diagnosed with rheumatoid arthritis. And her doctor was very helpful in explaining to her, well, this is basically a terminal disease. We can't cure it. We can give you some drugs to slow the progression of the disease, but you will end up in a wheelchair and you will die from this disease. And she was already in horrible pain. So one of the drugs that the doctor prescribed was methotrexate, which is a chemotherapy drug. And for a full year, she shares with us, weekly, she's injecting herself with a chemotherapy drug, which made her wish she was dead. It made her so sick, so nauseous. She shares with us she actually wishes she was dead. She's still in chronic pain with the rheumatoid arthritis. And and I've learned since then that this is common. If you have rheumatoid arthritis and it gets to a certain point, they put you on chemotherapy drugs, which is like worse than a cancer diagnosis. Like cancer diagnosis, you're going to get it for 3 or 6 months, not the rest of your life. So she, after a year, ends up going to a naturopathic doctor. And she says, the first thing she says to the naturopathic doctor is, I have an incurable illness. And the first thing he says to her is, there are no incurable illnesses. And then he cures her illness with nutrition and natural remedies. And now she's on no drugs. She's not in any pain. She's not facing a wheelchair and she's not facing death. But here's what makes me angry, Mark. How many Canadians with rheumatoid arthritis are being injected with chemotherapy drugs every week? Is it 10,000? Is it 100,000? Is it 200? Like, one's too much. This is just absurd. It's like, we've got legalized torture called our universal healthcare system. And, it's story after story after story. Like, we had, Jan in Lloydminster. Well, she had Crohn's for 30 years. You eat anything, it just goes straight through you. Could you imagine for 30 years not being able to go to a restaurant with your spouse? Or go to your kid's hockey game? You're basically completely disabled, and they have her on chemical drugs for 30 years to prevent flare-ups, and she's still ending up weeks at a time in the hospital when it flares up. And then she goes to a holistic practitioner, and now she's well. She's cured. So how many people are out there with Crohn's, having zero life, on dangerous synthetic drugs, third leading cause of death? Like, what's bugging me, Mark, is there's so many people suffering because of the censorship. Because just like the drug company can't share the failed clinical research, the natural health community, those that know, the practitioners and the manufacturers, they can't share these life-changing stories. And that's why we're doing it. That's why we're having this online health show and these live events, is because Canadians are suffering because they don't know that they don't have to be locked into this system that has no intention of actually treating or curing your illness. So we've adopted in our healthcare system, our universal healthcare system, what's called an allopathic model, which is just a philosophy of healing. And in that philosophy of healing, it's almost like you're forbidden from treating the underlying illness. Like, oh, you got an underlying illness that's causing suffering. The allopathic model deliberately does not cure the illness. It treats the symptoms of the illness. That's what the allopathic model is. And Mark, not in a million years would Canadians, if they have had a choice, have picked the allopathic model as the sole model for our universal health care. It's absolute madness. And then we limit their treatments of our symptoms to surgery and chemicals. It's like, how could we get worse health outcomes?
And, wouldn't it make sense to try the natural way first? And if that doesn't work, then go the medical side? Like, that seems like the appropriate step to take first. And if all else fails, then you go to the medical route. And it just seems backwards in Canada. And, I'm glad that you're bringing this attention and awareness to Canadians, because many people out there are suffering. And many people don't know what to do. And there also needs to be options. So can you specifically talk about, so in your experience, is it a liberal government thing? Is it all government? Like, how, explain to us what's happening, because I don't know anything.
Good question. Yeah. Okay, so it's not. So, I mean, I've been at this for 30 years. I actually started as a lawyer for Health Canada, and then I switched sides. But no, I mean, we've had, the Liberal governments are the worst, but the trajectory is the same. So Health Canada is always bringing in initiatives that, are meant to be, another basically tool to take the industry down another notch. Like, they're just trying to ratchet us down so that we're not vibrant and effective, and that we really stay chronically sick. Because what's the problem, Mark, is so many people have discovered this real, it's a secret, so I hope your audience promises not to tell anyone, but it turns out the human body needs certain nutrients to be healthy. Who knew? We can't get them from our food. And so many people now know this, that they're turning to the natural health community. And so they're trying to take us down. But both liberal governments and conservative governments have both, brought in initiatives that, they're Health Canada initiatives. They don't flow from the governments. But the conservatives are way easier to deal with. So when we have a conservative government, it's kind of like Health Canada soft. They're forced to be more reasonable. So clearly they're getting directions to lighten up and be more reasonable on natural products. So, I would much rather have to deal with a conservative government full stop than a liberal government when it comes to dealing with Health Canada. But Health Canada, it shouldn't be that Health Canada has to approve our access to vital nutrients. So, I jokingly said, don't tell anyone, but the human body needs nutrients to be healthy. Well, the reality is our leading cause of chronic illness. There's 3 leading causes of chronic illness. The leading cause is malnutrition in Canada. The U.S. Department of Agriculture regularly surveys the amounts of vitamins and minerals in our fruits and vegetables and grains and the like. And they've been doing this since like 1900. And they've documented a steady decline. I think it was in 1949, the report, they were sounding the alarm saying you can no longer be healthy by eating. And if you're missing this nutrient and this nutrient and this nutrient, here's the chronic illness you get, and so on and so on and so on. This isn't a secret. We had Udo Erasmus, the, kind of grandfather of healthy fats and omegas 3s and 6s, share at Vancouver, and he said, there's a whole bunch of essential nutrients, and they're called essential because without any one of them, you actually die. But you get sick along the way. We're chronically sick, largely because of malnutrition. That's the leading cause. Well, I interviewed 3 medical doctors for this online health show, and I asked each one, well, how much training in nutrition did you get? Oh, 2 hours, maybe half a day. They're deliberately not trained in nutrition, though, because they're in an allopathic model. So we've got all these chronic illnesses presenting, so we're going to the medical system because of chronic illness, which is really an expression by and large, of malnutrition or toxicity from our environment, primarily our food supply, or a combination of toxicity and malnutrition. And the medical doctors aren't trained. I'll share with you a story in a sec, but the point I'm trying to make is going to the medical doctor to treat chronic illnesses is literally like asking a blind person to help you across a busy street, because the leading cause of chronic illness is malnutrition in Canada, and they're not trained in nutrition. You know, we had a young mom who shared as one of our speakers. She was one of the first ones I had interviewed, and she has restless leg syndrome. So she, as soon as she goes to lay down at night, she describes it as electric shocks into her legs, and the muscles are twitching. So the only way to stop it is to walk around. So she's walking around all night long, not getting any sleep. She's getting fatigued. She's getting depressed. She actually loses the ability to care for her 2 young children. Her husband has to step in. And her medical doctor who diagnosed her with restless legs says, well, we don't have any treatments, but I'll put you on a Parkinson's drug. Well, she looks into the side effects and like, no way am I going on that. She comes across a naturopathic doctor and it's like, well, yeah, you're magnesium deficient. And 24 hours later, she's fine. And, you know, anyone in the natural health world, go to any health food store, they're going to put you on magnesium. It's kind of like, you're thirsty, drink water. So why don't the medical doctors know? Like, how many young moms are on Parkinson's drugs who have restless leg syndrome because they're magnesium deficient? And they're not trained in this.
So I have
and this is by design.
I have a question for you, Shawn. So for example, vitamins, they're trying to make vitamins have the same process to get approval as medicine. Would that mean, is that true? And would that mean that doctors could prescribe vitamins?
Yeah, it is.
If they get it approved?
Well, I mean, doctors can... The word prescribed means, you know, that it's only available by prescription. Now, in some countries in Europe, vitamin C over a certain level has to be prescribed by a doctor, if you can imagine, like, which is just insanity. So, but what Health Canada is trying to do, they've got this self-care framework where they want to impose the same, basically, regulations as for the chemical over-the-counter drugs as for our essential nutrients. And again, it's philosophically offensive that Health Canada can say we can't access nutrients in any levels we want. And they've actually made it illegal. So we have these recommended daily allowances. You know, you pick up a bottle, you know, vitamin D, recommended daily allowance, 100%. It's illegal for a supplement manufacturer to provide you dosage amounts above these RDAs. But if you follow the RDAs, you're guaranteed to be sick. So it's basically so we can't get the nutrients we need in our food. So we're going to become chronically sick. You must supplement in Canada. And it's illegal for the supplement manufacturers to provide you dosage amounts that you actually need to be healthy. So if you're not getting advice from a nutritionist or somebody in the know, you won't even know how to supplement. But they have this self-care framework where they want to perfectly harmonize with the over-the-counter drugs. So, you know, that means clinical evidence. So for most of our natural remedies, you know, we've been using ginger tea for 3,000 years to treat nausea. We didn't need thalidomide. But now if we want to use ginger tea to treat nausea, when they bring in these new regulations, you'll actually need to run clinical trials. We'll no longer be able to use traditional use evidence to, you know, get through Health Canada's hoops. Now, we shouldn't have to get their permission to use natural things that we've been using for thousands of years and which are in our food supply anyway. The crazy thing is we didn't need it until recently. This was just imposed on us in 2004. We were perfectly fine before. And in the United States, the FDA was trying to restrict their products and treat them as drugs. And Congress held hearings and actually passed a law saying, no, these are foods, they're not drugs. And they passed a law, it's called the Dietary Supplement Health and Education Act of 1994. By law, they're deemed to be safe. And yet in Canada, because we're in the drug model, vitamin C deemed by law to be unsafe. You got to prove to Health Canada that it's okay to eat oranges if you want to use them to prevent illness.
Well, this
I'm not
is
kidding. I wish I was making this stuff up.
what,
Like,
how is
Mark, if
this?
I said to you, you
How is this even possible, Sean? It seems like it doesn't make any sense at all. It's like you said, vitamins is like food based. It's concentrated vitamins derived from natural occurring substances. It's not, it doesn't make any sense that they would, uh, I understand they want to have a framework, want it to be safe. They're protecting big pharma, but at the same time, they're eliminating choice. What's the result that because this rolled out in 2024? What are we seeing the consequences of this rollout so far? And what can we do to help you or bring awareness? And where are we going with what can we do as people to protect ourselves and our rights to have vitamins and learn about it as well?
Yeah, so this self-care framework so far is, I mean, they basically harmonized the penalties. So we've gone from, if you resisted Health Canada before as a natural health product or a practitioner, your maximum fine, you could go to jail, but your maximum fine was $5,000 an offense. Well, now it's gone up to $5 million per day. And so this has sent shivers through the entire community. So, we were talking about censorship earlier. Well, there's an Alberta company, and I used antidepressant as an example because that was a true life federal court example where Health Canada experts sharing with me, they run 8 double-blind clinical trials to give Health Canada the 2. Well, there's an Alberta company called True Hope. There are over 30 published peer-reviewed journal articles, all funded by governments. So the Alberta government coughed up a big whack of cash to run a double-blind clinical trial out of Children's Hospital in Calgary, run by the Behavioral Research Unit at that hospital. It's illegal for them to share any of that peer-reviewed published research by governments. Well, they used to have links on their website, but these new $5 million a day fines came in, those disappeared. And, some stores are getting afraid to share with you truthful health information, and practitioners are becoming afraid to advertise truthfully. So the biggest effect right now is the censorship, but the next step is cost recovery, where they start charging us fees. And I think we're going to whole manufacturers are just going to say we're leaving Canada, and a bunch more will have to reduce the number of products, and we're going to lose our professional. Like, it's going to be an absolute train wreck unless we all get involved and stop it, which is why we've got this tour going on, is to bring attention to this and try to get the solution, which is this health charter, which basically takes, our common law traditions are almost 1,000 years old. It was like 1066 when William the Conqueror conquered and we started this common law. And over that 1,000 years, the courts have put bare minimum health rights that the state cannot cross. Because, 1,000 years of wisdom, like, okay, here's the bare minimum, state, you can't go any further. Like, there's got to be informed consent, and you've got the right to choose what you're going to do, and you've got the right to refuse treatments. So, and the government can't ever touch those according to our courts. Well, we've set those out because the government, this was in 2008, where Health Canada is just violating this over and over and over again. So we set these out in the health charter and just set out what's already the law. The government laws have to bend to this, and government actions have to bend to this. And then instead of having to fight Health Canada, the health charter creates a new Ministry of Wellness with a legal obligation to protect and promote our access to vital nutrients. It's common sense. So we've been collecting petition signatures to support this being passed into law. And we now have 153,000. It makes us the 3rd largest paper petition to be presented to Parliament in Canadian history, because Canadians are so passionate about this, and we're presenting those.
Shawn, can you send me a link of that, and I'm going to share it with my audience so that they could also sign the petition if they haven't done it as well? What else can my audience do to help you on your initiative to protect vitamins and nutrients in Canada? This is a huge subject, guys. We need to protect choice across the country, especially when it comes to our health. This is one of the most important subjects.
Oh, you watch the health show, it's life and death. Like I shared with you just a handful of stories where people are only alive because of these. And, you can't find a person. There are people in your circle that are only healthy. because of them. So go to nhppa.org and subscribe to our email newsletter. We typically only send one out a week. Like when we're doing a big event like this 3-week health show, we're sending 2 out a week. But we link you into action you can take. So right now on our website, there's an e-letter you can send to your MP saying, hey, pass the charter into law. Remember, we just spoke about these new higher penalties. There's a private members bill that was introduced in September, Bill 224, to undo that. So we're going to be running campaigns basically to have you interact with your MP, send e-letters, print them out and mail them, because that's even more effective, postcards and the like, asking your MP to support Bill 224. So we educate, and we also make it easy for you to interact with your MP and create pressure. And so, but we need a bigger, army, so to speak. We need a bigger group of people to create that pressure, because we're just not there yet.
Yeah, you know what? I'm all for this, Shawn. I'd love to have you back on my show to, the progress, tell us what's happening. This is huge. I appreciate you coming on today. Is there anything else you want to mention about what you're doing? I believe you're doing something in Ottawa in 24 hours, and maybe make that announcement. And once we get off this, to connect with you and schedule something else for my audience to watch.
Oh, I'd love to. So on Saturday, October 25th, we've got 2 events in Ottawa. So at 1 p.m. on Parliament Hill, we are presenting to MP Blaine Culkins the 3rd largest petition in Canadian history, for him to then have the Clerk of Petitions vet to be entered in Parliament. And then later in the day at 6:30 at Bikers Church, we're having our last live event of this charter tour. We're going to have a whole bunch of speakers, some people sharing their personal stories. I'm going to be sharing on, this drug model and censorship and the like. It'll shock people. It's going to be incredibly engaging, and it's important to come out and support, because it's part of this citizen initiative. This is all grassroots, just saying we gotta stop. We can't fight for vital nutrients anymore. And you can't censor all this truthful health information. We're not willing to be trapped. And I'm not here to knock the mainstream medical system, although it really is awful, because we wouldn't ever choose what we've chosen. We need to have an honest health discussion where the only question mark is, how do we get good health outcomes?
I agree. I completely agree. And I'm going to do everything I can to support you, Shawn. Thank you so much for coming on last minute. Hey, I called Shawn. I say, I'd love to have you in front, because this is such an important topic for Canadians to understand. Our choice to use natural remedy is in jeopardy in Canada. We need to get back to common sense, where we have the choice. Hey, I want to try to get healthy through nutrition as opposed to using the pharmaceutical route, or, try natural first. It doesn't work, then last resort. We need choice in Canada. Thank you so much, Shawn. Good luck on Saturday with your 2 events. I'm going to try to take a look at it, and I look forward to having you back on.
Mark, it's just a pleasure. And thank you for what you're doing. You're bringing awareness to things. Thanks.
We learned so much from Shawn Buckley today. I can't wait to have him back on my show when he has better internet connection, as well as getting an update. We need to defend our right to use vitamins to keep us healthy, as opposed to going to the doctor and they're providing us medical solutions. I look forward to bringing him back on the show. Let me know if you like this segment and if you want to hear from Shawn Buckley again. This is a very important subject. I want all of you to be as healthy as possible, and I believe we could get there through vitamins and nutrition. I'll see you on the next report.